we are going to Dr. Vasileia Chatzistergiou from Booking Clinic for the next presentation. Vasileia, hello.
Okay, so I'm Vasileia Chatzistergiou, medical doctor and communication manager of bookingclinic.com. And I would like to thank the team of the National Documentation Center for the invitation today to this very interesting event. So before getting deeper into what startups need from the public sector, let me just say a few words about what Booking Clinic does. So up to now, patients who needed treatment struggle to find detailed information, ratings and costs, or contact medical experts online in order to choose among the best doctors and clinics and book a treatment directly. BookingClinic.com connects patients to clinics and doctors online, providing an online tool to have virtual medical consultation and finally find, compare, and book the best clinic with a doctor of their choice at the best price. Patients have a 24/7 access to transparent information on experience, hospitality, ratings, total costs, and online video call upgrades customers' experience and trust. At the same time, clinics and doctors penetrate the online health market, they promote their services worldwide, they attract patients and medical tourists, and they improve their services by receiving feedback. So, up to now, we have built a network of clinics in 12 different countries with more than 200 doctors and 400 treatments of 16 medical specialties. So, during the past few years, digital health services have accelerated, offering great opportunities to providers. 1 billion Google searches actually per day are related to health, while 75% of users would use digital services to make more informed decisions by comparing benefits and prices. So with COVID pandemic, digital services have turned into a necessity, as I would say approximately the 1/3 of the global population was in lockdown. So in the fight against COVID, Booking Clinic offered its services for free, taking on board the humanitarian organization Médecins du Monde in order to provide telemedicine, as well as Action Aid and EASYS in order to provide video consultation on psychosocial support. We believe that the impact of this project to the society can be big, offering a relief to the national health system, minimizing the risk of virus transmission, and supporting people in need through live conversation with doctors and with advisors. So this was the project for which we were awarded and financed by the EIT Health Headstart 2020 on COVID in order to expand our solution to other countries. And actually after the InnoStars Award, where we were selected among the top 25 health startups in the EU, this was the second time that we were actively involved with the EIT Health and of course with the National Documentation Center. So through this initiative, as well as through the whole journey of Booking Clinic, we faced a lot of difficulties that I guess most of the Greek startups face during their first steps, for sure. So, first of all, startups may have built a company on an innovative idea based mostly on self-funding, but at this early stage where they need to grow fast, funding is not a very easy option for Greek startups. Funds usually require proof of concept translated as income or customers, drowning actually the startups in a vicious circle where they cannot gain money because they do not have customers and they cannot gain customers because they do not have money. The European Startup Monitor of 2016 showed that the Greek startups have received the least external capital compared to other countries. So it would be beneficial that new funding mechanisms are launched in order to support pre-seed companies and pre-sales companies and promising ideas and solutions. So income is not the only problem that startups meet. Due to tax policies and due to the complicated bureaucracy, a lot of startups choose to establish their company in other countries. Moreover, reports show that Greek startuppers are discouraged to have a second try in creating a business compared to startuppers of other countries such as Finland, UK, or Netherlands. And And this definitely highlights the necessity of a more flexible legislation. Thus, so a reform of the tax policies, along with the decrease of the bureaucracy that I would say haunts Greece in a lot of sectors, would allow Greek startups to grow within borders, would attract investors, and would enhance innovation. So at this point, I could actually mention an experience of our team, an experience that our team had in May, which is associated with the bureaucracy I'm talking about, when we applied for a European Space Agency funding of 400,000 euros. And after a very, very demanding application, we were selected to proceed with the final proposal. But in order to proceed with the final proposal, we were obliged to get an approval from the Greek delegation, which we had to get in only 10 days. So unfortunately, this never happened due to a legislative gap. And so we lost an opportunity of a very, very important funding by the ESA, the European Space Agency, a funding that could, of course, be a game changer for growth within Greece and, of course, in Europe. Overall, it's impressive that according to the 2016 survey of the EU Startup Monitor, Greece ranks last regarding government's understanding and support of the startups compared to other EU countries. So, beside the above adjustments, the public sector could also act as a catalyst, bringing innovative ideas to the market by serving as a pilot. For example, in our case, a big part of our business model, which is developed for the private health sector, could be applied for the public sector as well, showing the benefits of online services for the patient, as well as the benefits of more effective and transparent operations at the public health system as well. Moreover, according to a recent report of BCG, another 2 pain points for the Greek startups growth are the lack of collaborative networks among academic institutions, enterprises, and startups, and the lack of talent due to brain drain. Even though it has progressed a lot during the past few years, the Greek startup ecosystem is not yet adequately connected with institutions and enterprises that could actually generate novel collaboration and would boost the activity of all participants. The absence of this network, along with the brain drain that of the last decade that is responsible for the lack of young people with skills and energy within the country, adds more obstacles to the growth of startups. So it would be beneficial to build a network that connects different players of the ecosystem and becomes commercially and financially attractive to people who have left the country. An excellent example of such a network is the EIT Health and the National Documentation Center. And I'm not saying that because I'm invited to this event. For Booking Clinic, it has been extremely beneficial to participate in such a network that continuously supports us. And since Industars Awards, not only have we received financial support, which is crucial and really critical at this point, but we also benefit from being connected with lots of opportunities at an EU level, with mentors, with investors, with big companies from the health sector as well. So I would say that we feel part of this family, and we really appreciate the continuous interest and the support that we get throughout this whole journey of ours. So concluding, I would say that in Booking Clinic, as in many Greek startups, we start with passion and enthusiasm, and we're working hard to reach our goals, and it's a hard pathway for sure, but we believe that it's worthwhile. And in this pathway, the role of the public sector could really act as a catalyst, supporting and boosting startups in all the ways that I mentioned before. So thank you very much.